This is a 40-year-old left side rib pain. That was the history. The area of pain was labeled by a skin BB marker to indicate the area of pain. If you look carefully here, looking for any bone fractures, it's difficult to see any. So same thing on this side. Just a bigger field of view compared to the other side. But you should look carefully. There is a line here. This line shows there's long marking here, line, linear marking, and there's no marking here. There's an interface here. That is a pneumothorax that was not called. What I'm trying to show this case is subtle fracture in the ribs can be easily missed by plain film radiograph. This is the same case, oblique view. It's still difficult to see any fracture here. Frontal view of the same case, you just compare it to the other normal side, non-symptomatic side. It's very difficult to see any difference, except this bone, there was a subtle step off of the bone. Here it's not very smooth versus smooth on the other side. It's very subtle. However, on CT scan, it's not very subtle. You can see the comminuted fracture here at the 11th rib, the 10th rib, and the 9th rib. 9th rib, 10th rib, for subtle displacement, and the 11th rib. So the fracture resulted in a sharp needle kind of a bone spear that pierced through the lung parenchyma and resulted in pneumothorax and collapse of the lung. Here's the air, here's normal lung parenchyma, there is a pneumothorax. There's pulmonary contusion, basically a contusion of the lung parenchyma, just like the bruise on the subcutaneous tissue. You see the green and blue color discoloration. That's for the soft tissue bruises. This is lung bruises. Just to show you, this is the original impression of the chest X-ray, and then the later CT showed more finding. So the lesson is subtle radiographic fracture of the rib can be easily missed. We'll have to look carefully for lung parenchyma injury or pneumothorax. When in doubt, if patient's symptom is severe and there is high index of suspicion of abnormality, CT is a better way to detect trauma.